I've been practicing urology here in Toronto for over 20 years now. And if there's one conversation that makes even the most confident men shift uncomfortably in their chairs, it's this one. But here's the thing, folks. What I'm about to share with you could literally add years to your life, not just in quantity, but in quality. And I'm not exaggerating, eh? Last winter, a gentleman came into my office. Let's call him Robert. He was 73, retired from teaching, still shoveling his own driveway, despite his wife's protests. Sharp as a tack, or so I thought. He sat down and said, "Dr. Brooks, I can't remember things like I used to. My wife thinks I should get tested for dementia." He paused, looking down at his hands. "Is this just normal aging?" I asked him a series of questions about his sleep, his energy levels, his mood, and then I asked him about his sexual health. He went quiet. "Well, that ship sailed about 5 years ago," he said with a nervous laugh. "At my age, who cares about that, right?" Wrong. So incredibly wrong. Here's what most people don't realize, and what I wish every man over 60 understood. Sexual activity, including masturbation, isn't just about pleasure or intimacy. It's about your brain health, your heart, your immune system, your sleep quality, and yes, your prostate health. When you stop completely, and I mean completely, your body doesn't just shrug and move on. It responds, and not in a good way. Let me be crystal clear about what happens when older men abandon sexual activity entirely, because this isn't something we talk about enough in Canada, or anywhere really. We're so polite about it, aren't we? But I'm going to be direct with you today, because your health depends on it. The first thing that happens, and this one surprises most of my patients, is what occurs in your brain. See, sexual arousal and climax trigger a cascade of neurochemicals. Dopamine, oxytocin, endorphins. These aren't just feel-good chemicals, folks. They're maintenance workers for your brain. They strengthen neural connections, improve memory formation, and help protect against cognitive decline. I've seen the research, and I've seen it play out in my practice over 2 decades. Men who maintain regular sexual activity, whether with a partner or through self-stimulation, consistently show better cognitive function in their 70s and 80s. It's not just correlation, it's causation. When sexual activity drops to zero, particularly after age 60, the risk of cognitive impairment increases significantly. But here's where it gets really interesting, and where Robert's story comes back into play. Testosterone doesn't just affect your libido. It affects your memory, your decision-making ability, your mental clarity, your confidence. And when you stop all sexual activity, your testosterone levels can drop faster than they would naturally. It's like your body says, well, if we're not using the system, why maintain it? I started Robert on a plan that included, among other things, encouraging regular self-stimulation. 2 or 3 times a week, I told him. His face went red, but he listened. 6 months later, he came back. "My wife says I'm sharper," he told me. "And honestly, Doc, I feel 20 years younger mentally. I didn't realize how foggy I'd been feeling." Now, let's talk about your prostate, because this is critical, especially for you folks up here in Canada, where prostate cancer rates are significant. Your prostate needs regular activity to stay healthy. Think of it like any other organ. Use it or lose it applies here too. When you ejaculate regularly, you're flushing out the prostate. You're clearing out potentially harmful substances, reducing inflammation, and maintaining healthy function. Studies have shown that men who ejaculate at least 21 times per month have a significantly lower risk of prostate cancer compared to those who ejaculate 4 to 7 times per month. 21 times a month. That's about 5 times a week, folks. Now, I'm not saying you need to hit that exact number, but the principle holds: regular activity matters. And for men who don't have partners, whether you're widowed, divorced, or just haven't found someone, self-stimulation isn't just acceptable, it's medically beneficial. I had another patient, let's call him David, 78 years old, widowed for 12 years. He'd completely stopped all sexual activity after his wife passed. He developed benign prostatic hyperplasia, had terrible urinary symptoms, couldn't sleep through the night without getting up 3 or 4 times to use the washroom. When I suggested regular self-stimulation as part of his treatment plan, he looked at me like I'd suggested he take up skydiving. But he tried it. Combined with other treatments, yes, but within a few months his symptoms improved. Not completely, BPH doesn't just disappear, but enough that he could sleep better, enough that his quality of life improved dramatically. Here's something else that happens when you stop all sexual activity. Your cardiovascular health takes a hit. Sexual activity, including masturbation, is exercise, folks. Your heart rate increases, blood flows, your vascular system gets a workout. It's not the same as going for a run along the Don Valley Trail, obviously, but it's beneficial. Regular sexual activity helps maintain vascular health, reduces blood pressure, and improves circulation. When you stop entirely, especially if you're not particularly active otherwise, your cardiovascular system suffers. I've seen men in their 60s and 70s who gave up on sex completely and then wondered why they felt so sluggish, why their blood pressure crept up, why they had no energy. And let's talk about sleep, because this is huge. How many of you lie awake at night, mind racing, unable to shut it off? Sexual climax releases a cocktail of chemicals that promote relaxation and sleep. Prolactin, oxytocin, serotonin. It's nature's sleeping pill, folks, and it's free and has no side effects. I can't tell you how many patients have come to me complaining about insomnia. And when we dig into their lifestyle, it turns out they've completely abandoned sexual activity. They're taking Ambien, they're drinking chamomile tea, they're counting sheep, but they're missing one of the most effective natural sleep aids available to them. Now, here's where I want to address something that's been weighing on my mind. In over 20 years of practice, I've noticed a troubling pattern. Many older men carry tremendous shame about masturbation. They were raised in an era where it was considered sinful, dirty, something to be ashamed of. Folks, I need you to hear this. That's outdated thinking that's literally harming your health. There's nothing shameful about maintaining your sexual health, whether you have a partner or not. In fact, it's an act of self-care, of taking responsibility for your well-being. You brush your teeth, right? You take your medications, you get your checkups. This is no different. It's maintenance, it's healthcare. I've had patients tell me they stopped because they thought it was inappropriate at their age. Inappropriate? Says who? Your body doesn't stop being sexual just because you hit 60 or 70 or 80. The need for sexual expression, for that release, for those health benefits, that doesn't disappear. It changes, yes, but it doesn't vanish. Let me tell you about immune function, because this ties into everything else. Sexual activity boosts your immune system. Studies have shown that people who have sex regularly have higher levels of immunoglobulin A, an antibody that helps protect against colds and infections. In our long Canadian winters, when everyone's cooped up inside, passing around every bug imaginable, having a strong immune system isn't luxury, it's necessity. When you stop all sexual activity, you lose this immune boost. Combined with the stress that often accompanies aging, loneliness, loss, health concerns, and you've got a recipe for increased illness. I've noticed this pattern clinically. Men who maintain sexual activity by whatever means tend to get sick less often, recover faster when they do get sick, and generally have more robust immune responses. Now I know what some of you are thinking, but Dr. Brooks, I'm not interested anymore. My libido is gone. Here's the thing. Sometimes you need to jumpstart the engine, eh? Libido can be like appetite. If you don't eat for a long time, you stop feeling hungry. But when you start eating regularly again, appetite returns. Same principle applies here. Many men find that once they start engaging in sexual activity again, even if they don't particularly feel like it at first, their libido gradually returns. It might not be what it was at 25, and that's okay, but it comes back. The interest returns, the pleasure returns, and with it, all those health benefits we've been talking about. Let me address the practical questions I get asked all the time, because I know you're wondering. How often? Look, there's no magic number that works for everyone, but based on the research and my clinical experience, 2 to 3 times a week is a solid target for men over 60. Some of you might be comfortable with more, some with less. The key is consistency, not perfection. Is it the same as sex with a partner? No, it's not identical. Sex with a partner has additional benefits: intimacy, emotional connection, the physical workout of actual intercourse. But masturbation provides most of the same physiological benefits: the hormone release, the prostate health benefits, the cardiovascular workout, the sleep aid. So if you don't have a partner, or if your partner isn't interested or isn't able for health reasons, self-stimulation is an excellent alternative. What if you have prostate issues already? Great question. If you have benign prostatic hyperplasia, regular ejaculation can actually help with symptoms. If you've been treated for prostate cancer, talk to your doctor. But in most cases, sexual activity is encouraged as part of recovery and maintaining urinary and sexual function. If you've had surgery, there's usually a waiting period, but then it's use it or lose it. You need to maintain erectile function through regular activity. Here's something I don't think gets talked about enough. The mental health aspect. Depression and anxiety are common in older men, particularly those who live alone. The suicide rate for older men in Canada is shockingly high, and loneliness is a significant factor. Sexual activity, including masturbation, releases endorphins and dopamine, natural mood elevators. It's not a cure for depression, obviously, but it's a tool in the toolbox. I've had patients tell me that regular self-stimulation helped them feel more connected to their bodies, more alive, more present. It reminded them that they're still vital, still capable of pleasure, still here. In a culture that often treats older people as if they're already halfway out the door, that reminder is powerful, folks. Let's talk about what happens to your self-esteem when you abandon sexuality completely. Many men tie their sense of masculinity, their confidence, to their sexual function. When they stop engaging sexually, even by choice, it can create this feedback loop. I'm not sexual anymore, therefore I'm not really a man anymore, therefore I have nothing to offer. It's heartbreaking, and it's unnecessary. Maintaining sexual activity, even alone, helps maintain that sense of self, that confidence, that feeling of vitality. You're reminding yourself that you're still capable, still functional, still you. That might sound touchy-feely, but I've seen what happens to men's mental health when they completely disconnect from their sexuality. It's not pretty. Here's another thing that often gets overlooked. The physical act of self-stimulation maintains sensitivity and function. If you stop using your erectile tissue, it can lead to fibrosis, scarring, loss of function. It's similar to any other body part. If you don't use your muscles, they atrophy. If you don't stretch, you become inflexible. Your penis is no different. Regular erections, through sexual activity or masturbation, help maintain tissue health and function. I've had patients in their 80s who maintained excellent erectile function because they never stopped being sexually active. And I've had patients in their 60s who'd stopped for just 5 years and found they could barely achieve an erection anymore. The difference isn't age, folks. It's use. Now, let me circle back to something crucial that I haven't emphasized enough. This isn't about performance. This isn't about proving anything. This is about health maintenance, plain and simple. You're not trying to set records here, eh? You're taking care of your body the same way you take care of your teeth, your heart, your cholesterol levels. I want to address the folks who are in relationships but haven't been intimate in years. This happens more than people realize. Life gets busy, health issues arise, intimacy fades, and before you know it, it's been years. If you're in this situation, I encourage you to have an honest conversation with your partner about restarting some form of sexual activity, even if it's just mutual self-stimulation. But if that's not possible for whatever reason, individual self-care is still important for your health. Let me tell you about one more patient. James, 69 years old, married for 42 years. He and his wife hadn't been intimate in over a decade due to her health issues. He'd stopped all sexual activity out of respect for her, or so he thought. He developed depression, his blood pressure went up, he had chronic insomnia, his memory was failing. His wife finally asked him what was wrong. When he explained everything to me, including his wife's reaction, she told him she'd never expected him to become celibate, that she wanted him to be healthy and happy. We developed a plan together. His health improved across the board within 6 months. The point is, taking care of your sexual health isn't disrespectful to a partner who can't participate. It's not selfish. It's necessary. And most partners, when they understand the health implications, are supportive. Communication is key, folks. I also want to acknowledge that some of you watching this might be dealing with religious or cultural beliefs that condemn masturbation. I respect your beliefs, I truly do, but I also have a responsibility as a physician to tell you the medical facts. Regular sexual activity, including self-stimulation, has significant health benefits, and completely abstaining can have negative health consequences. How you reconcile that with your beliefs is between you and your faith, But you deserve to make that decision with complete information. Here's what I want you to take away from this conversation, folks. Your body was designed to be sexual throughout your life. The fact that you're 60, 70, 80 years old doesn't change that fundamental biology. Society might tell you that sexuality ends at a certain age, but your body didn't get that memo. You have a choice. You can abandon this aspect of your health and accept the consequences. The cognitive decline, the prostate issues, the cardiovascular problems, the insomnia, the weakened immune system, the depression. Or you can maintain this part of your well-being, or just like you maintain every other part, and enjoy better health, better sleep, better mood, better quality of life. It's not about being obsessed with sex. It's not about being inappropriate. It's about being realistic about human biology and making informed decisions about your health. You wouldn't stop brushing your teeth because you're retired, right? You wouldn't stop taking your blood pressure medication because you're not working anymore. This is no different. I've spent over 20 years helping men navigate aging and health challenges here in Canada, from Vancouver to Halifax and everywhere in between. And I can tell you with absolute certainty, the men who maintain sexual activity, whether with partners or alone, consistently have better health outcomes across almost every measure. Better cognitive function, better cardiovascular health, better prostate health, better mental health, better quality of life. So here's what I want you to do. First, if you've completely stopped all sexual activity, I want you to talk to your doctor. Make sure there aren't underlying health issues that need to be addressed first. Get your testosterone checked, get your prostate checked, make sure everything's in working order. Then, if you get the all clear, I want you to start reintroducing sexual activity into your life. Start slowly if you need to. Maybe once a week at first, then build up to 2 or 3 times a week. Pay attention to how you feel, your energy, your mood, your sleep, your mental clarity. I think you'll be surprised at the difference it makes. And if you're feeling embarrassed or ashamed, remember, this is healthcare, folks. This is you taking responsibility for your well-being. There's nothing shameful about that. Nothing at all. You deserve to feel vital, energetic, sharp, and healthy for as long as possible. Don't let outdated taboos or misplaced shame rob you of years of good health and quality of life. Your body is still capable of pleasure, still capable of function, still capable of healing and maintaining itself. But it needs your cooperation, eh? Take care of yourselves out there, folks. And remember, there's no age limit on health, vitality, or taking care of your needs. You've earned the right to feel good in your body, no matter how old that body happens to be.